Welcome to the channel. I'm really glad you're here. Today we're diving into a topic that affects millions of people worldwide, but most of them have no idea they're even dealing with it. It's something that can leave you feeling exhausted, moody, achy, and just off. And yet it's often overlooked. I'm talking about vitamin D deficiency. The symptoms can sneak up on you, subtle, quiet, easy to ignore. But over time, they can start affecting everything from your energy and mood to your bones and immune system. So in today's video, we're breaking down the signs of vitamin D deficiency that you should never ignore, and what you can do about them. Vitamin D is often called the sunshine vitamin because our bodies naturally produce it when we're exposed to sunlight. It's essential for strong bones, a healthy immune system, and even mental well-being. But here's the thing. With modern lifestyles that keep us indoors, long winters, cloudy climates, and sunscreen use, many of us just aren't getting enough of it. And the scary part? You could be deficient for months or even years without realizing it. So let's get into the most common and often most surprising signs of low vitamin D levels. Let's start with the big one: chronic fatigue. If you feel constantly tired even after a full night's rest, low vitamin D could be the culprit. This vitamin plays a big role in how your cells produce energy. Without enough of it, your body starts to slow down. You might feel sluggish, unmotivated, or just worn out all the time. Sound familiar? Another major sign is low mood or symptoms of depression. Vitamin D helps regulate serotonin, the feel-good chemical in your brain. Low levels have been linked to depression, anxiety, irritability, and even seasonal affective disorder, SAD, especially during the darker months. So if your mood takes a dip and you can't explain why, it could be more than just stress. Next up, bone and muscle pain. Many people assume aches and pains are just part of getting older or being active, but consistent pain in your lower back, legs, or joints could actually be due to low vitamin D. This vitamin is essential for calcium absorption, which keeps your bones strong. Without it, bones can weaken, sometimes leading to conditions like osteoporosis later in life. Now here's a sign most people never connect to vitamin D: getting sick more often. If you feel like every cold, cough, or infection finds its way to you, it could be because your immune system is struggling. Vitamin D is a powerful immune regulator. Low levels can make you more vulnerable to viruses and bacteria. Another subtle but serious sign? Slow wound healing. If cuts, bruises, or surgical wounds are taking longer than usual to heal, that's a red flag. Vitamin D supports the production of new skin cells and helps fight inflammation. If you're not healing like you used to, your body might be missing this critical nutrient. Let's talk about hair loss. While there are many reasons for thinning hair, stress, genetics, hormones, a lack of vitamin D can also be a trigger, especially for women. Vitamin D plays a role in hair follicle health, and low levels may contribute to conditions like alopecia. And then there's muscle weakness and poor physical performance. This is especially common in older adults. Without enough vitamin D, muscles lose their strength and coordination, increasing the risk of falls and injuries. But even younger people can feel this as general weakness or low stamina during workouts or physical activity. Some people also experience brain fog, poor concentration, or forgetfulness. If your mind feels cloudy or you're having trouble focusing, it might not be burnout. It could be your body trying to tell you something. You may even notice weight gain or difficulty losing weight. While the research is still developing, some studies suggest a possible link between low vitamin D and increased body fat or metabolic slowdown. It's not the only factor, but it's definitely worth checking. Now, if you're noticing one or more of these signs, don't panic. The good news is that vitamin D deficiency is usually easy to correct. Step 1. Get tested. A simple blood test, the 25-hydroxy vitamin D test, will tell you exactly where your levels stand. Most experts consider 30 nanograms per milliliter to be the minimum, but for optimal health, you may want to aim for 40 to 60 nanograms per milliliter. To boost your levels naturally, aim for 15 to 30 minutes of direct sunlight a day, ideally in the morning when the UV index is safer. If sunlight isn't possible where you live, focus on food sources like fatty fish, like salmon or sardines, egg yolks, mushrooms, and fortified foods like milk, cereal, and orange juice. In some cases, your doctor may recommend a vitamin D3 supplement, which is more effective than D2 for raising levels. But remember, more isn't always better. Too much vitamin D can also be harmful, so never self-dose high amounts without guidance from a healthcare provider. The bottom line is this: your body speaks to you through fatigue, mood, pain, and more. If you've been feeling off and can't figure out why, it's worth looking into your vitamin D levels. Awareness is the first step toward healing, and even small changes can lead to major improvements in your energy, mood, and overall health. If you found this video helpful, make sure to give it a thumbs up, share it with someone who might need it, and don't forget to subscribe for more health content just like this. Thanks for watching, and always remember, your health is your greatest.